Assalamualaikum everyone. In today's video, we are going to discuss about pharmacology, and the book which I taken up for this is Lippincott Illustrated Reviews. So this is very useful book, and I think you will get a lot of benefits from it. And this book will be really helpful, and it has a lot of various beautiful diagrams with which you will be clearly understand the difficult concept. So now, before we are going to start the lecture, I request you to please subscribe to my channel and like my videos, and also press the bell icon to get the notification of all the videos which I have uploaded. So now before in the chapter number 1 from this book, as you can see here, they started a topic with the pharmacokinetics. Actually, pharmacokinetics is the branch of pharmacology. So in this book, directly the branches of pharmacology are going to start, but in my video I will start this lecture with the definition, with the basic of pharmacology. Okay, so now let's discuss the definition of pharmacology, and you can note everything I speak in your notes. Okay, so, what is mean by pharmacology? Actually, the word pharmacology is derived from two words. As you can see, two words. First word is pharma, and the second word is ecology. Okay, the word pharma means the word pharma comes from a Greek word which is pharmakon, and the word ecology means study, means in pharmacology we are going to deal and we are going to study the drugs. Okay, now what is the specific definition of pharmacology? Actually, in pharmacology it is the study of medicines. In this branch we are going to study about the drugs, their property, their physical, chemical, and all of these properties of the drugs are studied. Also in pharmacology we also study what is the effect of a particular drug on our body. And third thing, we also discuss about the mechanism of action of drug and the effect of body on the drug. Our body also give response to the drug, and our drug also effect on our body. These are the two different terms, and you have to make a concept in it. Okay, for example, I given a drug, this drug, to a patient. Okay, and this drug will do specific kind of reaction inside the patient body. And patient body, for consider this is the patient body, this patient body produce specific effect against that drug. Okay, so these are the two different terms, and you have to must relate them. So this is the basic pharmacology, and in the pharmacology we get four things. If someone say you that why you are studying pharmacology and what is the scope of pharmacology, so pharmacology is telling you four things. First, in the pharmacology you can see what is the effect of drug on your body. Second thing is that you will study what is the effect of your body on the drug. Third thing is that you will study the whole mechanism of action of drug, that if you are taking some drug which is responsible for lowering your blood pressure, so how this drug will do its second. There is no something like magic and will occur and your blood pressure goes down. Nothing will happen like that. There is a proper mechanism for the drug to act. This drug will go in a specific way, it will go undergo a metabolism, it will distribute itself, it will lose its active component, and then this active component will go target on the active part, and then the specific kind of reactions will occur. So there is a whole mechanism of various steps, and after that this proper action is going to be performed. And the last thing is that in pharmacology you are going to study drugs. You are going to study what kind of drugs are obtained from the natural source, from the artificial source, how we are going to prepare them, and what is their effects. What means, what are the drugs which are responsible for lowering blood pressure, what are the drugs which is responsible for increasing the blood pressure. So all the drugs will you are going to study in this branch. So it is very vast and very extensive branch of medicine. So now we discussed that everything of pharmacology is just rotate around the world. And which word? Word pharma. Word pharma is rotating in this branch. And the word pharma mean what? Drug. So in this whole branch you are going to study everything about the drug. So now let's discuss what is a drug. Okay, sometimes we discuss it as a drug, sometimes we use a word medicine. So there is a specific difference between them. Drug is a substance which is can be used for the treatment, can be used for the diagnose, can be used for the prevention, can be used for the proper treatment, can be used for prevention of a particular disease. But when you are going to discuss the medicine, medicine is just only for the treatment of a particular disease. Okay, so this is the basic and major difference between them. Second difference is that the drug has a proper no proper dosage form. There is no dosage form of drug, and it is in the form of crude form. Okay, but medicine has proper dosage form and it has modifications. Okay, the crude drug under the good modifications, and it is treated at various kind of active compound and excipient is added in it, and after that we make a medicine which is only for the treatment. Okay, now next difference is that drug can has a positive as well as negative effects on your body, but the medicine always has a positive effect. But you cannot say 100% positive effect, but a small term of negative effects can occur. What is mean by positive effect and negative effect? I am saying that the positive effects mean beneficial effects, and the negative effects mean adverse effect, okay, which is harmful for your body. So this is the mutual difference between the drug and a medicine. So I think now you are capable to answer that what is the difference between a drug and a medicine. Now let's discuss what is a drug is doing and revolving in the pharmacology, and why we are taking drug only. We can take medicine in the pharmacology as well. We can study what is the effect of medicine on the body. We can study what is the effect of body on the medicine. Okay, but we are saying drug. Why we are saying drug? First, to understand this concept, you have to see what is the definition of drug. Okay, so now in the pharmacology, you will define drug as it is a substance that introduce in your body, that is going to taken up by you and enters in your body to produce a change in the biological system. Now what is the biological system? This is the question which should be given by you to me. So this biological system means anything that you eat and anything that enters into your body, and then this thing will become the part of your biological system. Your biological system includes all the organs which are present in your body, all the cells, all the tissues, and when a particular germ enter from outside to inside your body, these germs will also become the part of your biological system. Now after entering of this germ, we give the patient a drug to change this biological system, because now your biological system is defective because a germ is entering your body. So we have to produce the change. Okay, first your biological state is in the normal state. Now I am donating this normal state with the n. Okay, it is in the normal state, having a healthy diet, having a healthy individual, having all the proper ratios in his body. Okay, having a proper and a balanced biological system. Now what is going to occur? He eats something bad, and some kind of germs enter into in his body. Now his biological system is going to change. His biological system will become pathological state. Pathological, the word patho always mean a germ. Now his body biological system is converted into a state which is called as pathological state. Now in that state, what you have to do now, you have to treat that person. This person is a diseased person, this is a patient. Now this patient come to you, and you have to give her a drug to treat her. Okay. Now in order to treat her, you will give her a drug, and after giving this drug, and after the whole mechanism of action of this drug, this pathological condition will again converted into the normal state in the normal biological system. So now what is drug is doing? It is changing this state. It is converting this pathological condition into the normal condition. It is changing your biological system. So that's why I say in the definition of drug that it is a substance that is changing your biological system, to convert your pathological state into your normal biological state. Okay. So this is the definition of drug in pharmacology. Okay. So I think this will be better for you. So now till up, if I produce the summary of all the things which I have concluded to you, is that pharmacology is just the interaction between your drug and your biological system. Your drug will acting on your biological system, and your biological system will producing response in response to the drug action. So whole this interaction is going to occur, and due to this interaction, this branch of science, this branch of medicine is happened, which is named as pharmacology. So I think this introduction will be beneficial for you, and if you have some question and some doubts and some confusion about that, then you can question me in the comment section. And if you don't subscribe to my channel, then go press the subscribe button and also press the bell icon to get the notification of all the videos which I have uploaded. Thank you so much for subscribing to me. Now let's go to the next part. The next part is the branches of pharmacology. There are many branches of pharmacology, but in this today's lecture, we just discuss the name of two branches, two main branches. Okay, we are not discussing the minor branches, but we are discussing main branches. There are many branches of pharmacology, more than hundreds and more. But in today's, we just focus on the two. So the first branch of pharmacology is your pharmacokinetics, as this word indicate, as your first chapter name, which is pharmacokinetics. And the second branch is pharmacodynamics. Okay. So these are the two major branches. Now let's start the pharmacokinetics. So as its word indicate, consists of two words, as you can see, pharma and kinetics. Okay. Pharma, pharma kaun se hai, and it means drug. Very good. Kinetics, you study about kinetics in the physio in the 9th 10th and something like that. So I think you know what is the meaning of kinetics. Yes, very good, you know very well. Kinetics mean movement, means your drug is going to move. You are going to study how your drug is going to move inside your body. Okay. So actually we are going to study that what is the effect of body on your drug, how the drug will enter into your body, and how it will distribute it in your whole body. This is study in this branch. So what happened? Let's consider a state. You get a diarrhea, and you have to take the medicine. And I will give you a oral taken medicine, and you will eat it. Okay. First you take the pill and swallow it. It will goes into your esophagus. After esophagus, it will goes to your stomach. Okay, after stomach, it will goes to your what? Yes, small intestine for the absorption. Okay, you know very well that the absorption occur in your small intestine. After this absorption, it is goes to your blood. Okay, it will goes to circulate in whole your blood. Now it will goes to the specific area to treat the diarrhea. Okay, so the diarrhea cannot be treated by acting upon the lungs. Okay, so there is no relation between the lung and the diarrhea disease. Okay, so it is going to act on the particular area. It will goes to that area with the blood, and then after reaching it, it will produce a response, and it will prevent the diarrhea and save you from that condition. So this is the whole mechanism by which your drug is moving inside your body. Okay, now just look at this overview which is given to you in that book. It is not so necessary, so let's just read out it. So the goals of drug therapy is to prevent, is to cure, is to control various disease states. To achieve this goal, the adequate drug dosage must be delivered to the target tissue so that therapeutic yet non-toxic levels are obtained. Okay, so your drug should have therapeutic values and should be non-toxic. Pharmacokinetics examine the movement of a drug over the time through your body, that how the drug is going to move, how it is absorbing, how it is distributing, how it is metabolizing. All these things should be studied in this that branch. Pharmacological as well as toxicological actions of drug are primarily related to the plasma concentration of drugs, and the clinical must be recognized thus then speed onset the drug action. So I think I not have to repeat all of these terms, because the absorption, distribution, all of these terms are written, and I think it's just a time wasting to read out all of these paragraph, because nothing important is written in there. Just the four main points is written, that your drug is being absorbed, then it is distributed, then metabolized, and after that it inhales. Okay, so this is the specific route for the movement of your drug. Now let's see the diagram here. This is the drug site. You eat it, it will goes for the absorption in the small intestine. After that it will goes to plasma or blood is the same thing. Okay, so after the plasma, it distributed itself into your whole body. It will goes to your tissues. Here it undergo the metabolism. After the metabolism in tissue, it will eliminates out of your body. Okay, so it is very unuseful to store the drug inside your body. Okay, it will cause disease. So it is very useful to eliminate it out after the use. So drug or metabolize in urine, in bile, and in feces, and in that way your drug is excreted out, not stored in your body. It is emanated out. Now let's see what is the route of drug administration. As I have explained all of these things in this diagram, so now let's just read it out. The route of administration is determined primarily by the properties of drug, that what kind of drug is you are eating, whether it is acidic dissolving, whether it is basic dissolving. If your drug is readily dissolved in acid, then it will dissolve quickly in stomach. But why? Let give me the answer of it. Because stomach contain acid and it contain the pH 2. When a drug which is soluble in acid goes to stomach, it completely digests into your stomach. But there are some drugs which are soluble in basic medium, in alkaline medium. So when these drugs goes to your stomach, they will not dissolve, because these drugs cannot be dissolved in acidic medium. So in the small intestine they will given the alkaline medium, and then they will break down and undergo the digestion process. So these the absorption, the digestion of drug also depend upon the proper property of that drug. Okay, For example, water or lipid. Okay, solubility, its ionization, all the things is method. Is pH, is ionization ability. So sorry for this interruption, and I think you will ignore this mistake. So now let's start. We will discuss the route of drug administration, and I think some drug need long time of administration because of some restrictions. As I say, there is a restriction for the basic drug when it goes to the stomach, and there are two major routes of drug, and enteral and a parenteral. Okay, so there are two routes. First is enteral, whether you give your drug orally. Okay, and parental. Okay, now let's just discuss these enteral and parental. So enteral administration, or administering a drug by mouth. Enteral mean enter through your mouth. Everything will enter through your mouth. Okay, whether a germ, whether some type of microbes, some type of bacteria, viruses, they enter usually through your mouth, because the opening part of body is rarely exposure, and it will quickly get the germs from the air and something like that. So the enteral is the position whether you are eating or swallowing your drug with the mouth, and is the simplest and most common mean of administering a drug. Mostly 80% of all of the drugs are taken orally, but some types of drugs should be given with the help of injections, with the help of drips, and with the help of different other things. Okay, so when the drug is given in the mouth, it may be swallowed and orally delivered, and it may be placed under the tongue. Okay, sometimes the doctor call you that place that medicine under your tongue. So that is the beneficial to facilitate the absorption into your bloodstream. Okay, so this is the enteral route, and first you will give the oral drug. Giving a drug by mouth provide many advantages to the patient because it can be easily self-administrative and limited number of system infections. So there are many limited number of infection when you take the drug orally. Okay, because when you give the injection, sometimes the place of injection displaces and the death of the patient can occur. So the most safest place to give a drug is through the mouth. And moreover, toxicities and overdoses by oral route may come, but it quite has some beneficial effects. On the other hand, the pathways involved in drug absorption are more complicated, and drug is exposure to the harsh gastrointestinal secretions environment, and they may be limit its absorption. Okay, so क्योंकि gastrointestinal tract की जो environment है वो इतना ज़्यादा strong होता है, कभी strong acidic है तो कभी strong basic है, तो इसके environment की वजह से उसकी जो absorption है वो थोड़ी सी limit हो जाती है, बट ये इतना ज़्यादा बड़ा हमारे कह सकते हैं कि एडवर्स इफ़ेक्ट नहीं है. ठीक है, यूज़फुल है फिर भी हमारे लिए, क्योंकि इसकी जो बेनिफिट्स हैं वो ज़्यादा हैं इसकी डिसएडवांटेजेस से. So some drugs are absorbed from the stomach. However, the duodenum is the major site of entering the systemic circulation. So from duodenum, your drugs are going to enter your systemic circulation. Here your systemic circulation mean whole your body blood. Okay, systemic circulation of blood. Okay, because it's large absorptive surface, and most of the drugs absorb from GIT under the portal circulation. You know about the portal circulation, means the gastrointestinal tract is going to connect with your liver. So इस तरह से ये absorb हो रहे हैं, और these drugs undergo first pass through the metabolism of liver. They metabolize in liver, and then they may be extensively metabolized before entering the systemic circulations. तो यहाँ पर इन्होंने एक एग्जांपल दी हुई है, more than 90%, ये एग्जांपल दी हुई है यहाँ पर, more than 90% of nitroglycerin is cleared during a single passage through the लीवर, क्योंकि लीवर आपका मेजर पार्ट है जो कि आपकी बॉडी को मेटाबलाइज कर रहा होता है, ये प्राइमरी एजेंट है. ड्रग दैट एग्जिबिट हाई फर्स्ट पास्ट मेटाबॉलिज्म एंड देन दे विल given in the sufficient quantity. Presence of food in stomach delays gastric emptying, and so the drug are destroyed by the acid. For example, penicillin की जो drug है वो acid stomach के acid से जो है वो digest हो जाती है, become unavailable for the absorption, तो वो absorption के लिए नहीं रहता है, वो digest हो जाता है. इसी तरह आप लोग यहाँ पर देख सकते हैं एंटेरिक कोटिंग की जाती है ड्रग. देखिए अगर कोई ड्रग है, हम चाहते हैं कि वो स्टमक में डिज़ोल्व ना हो, ठीक है ना, हमने उससे बचाना है, क्योंकि हमने कहा पेंसिलिन कम्प्लीटली डाइजेस्ट हो जाती है एसिडिक मीडियम में. इट्स मीन कि आप जैसे पेंसिलिन खाएंगी तो वो कम्प्लीटली एब्जॉर्ब हो जाएगी आपके स्टमक के अंदर. अब वो एब्जॉर्ब तो नहीं हुई, उसका कोई इफेक्ट ही नहीं होगा, वो तो डाइजेस्ट हो गई. जैसे आप फूड ले रहे हैं वैसे डाइजेस्ट हो गया, उससे कुछ भी नहीं मिला, वो एक्सक्रीटेड आउट हो जाएगा ऐसे ही. हमने क्या करना है, हमने उसके ऊपर इंटेरिक कोटिंग करनी है. इंटेरिक कोटिंग हम कैसे करते हैं, फॉर एग्जांपल ये अगर आपकी पेंसिलिन की ड्रग है तो हम इसकी के ऊपर एक कवर कर देते हैं इस तरह से. अब इस कवर करने से ये क्या होता है कि वो एसिडिक मीडियम से प्रोटेक्ट होता है, यानी वो जब आपके स्टमक में जाएगा तो स्टमक का जो गैस्ट्रिक जूस है वो उसके ऊपर इतना ज़्यादा इफेक्ट नहीं करेगा, जिसकी वजह से वो प्रिवेंट हो जाएंगी गैस्ट्रिक जूस की इरिटेशन से, और फिर इस तरह वो इजीली एब्जॉर्ब हो जाएंगी जब वो स्मॉल इंटेस्टाइन में जाएंगी. यहाँ पर आपको ये दिखाया गया है, सबलिंगुअल में इनहेलेशन कर रहा है, ओरली उसको मेडिसिन एक कैप्सूल दिया जा रहा है. तो इस तरह से हम कुछ टॉपिकल ये एरियाज़ है जहाँ से हम दे सकते हैं, इंजेक्शन दे सकते हैं, ड्रिप लगा सकते हैं. तो वो ये दिखा रहे हैं कि कहाँ कहाँ के रूट्स हैं जहाँ पर हम लोग पेशेंट को जो है ड्रग दे सकते हैं, ठीक है, सोर्स क्या है. अब संगलुनर में भी देख सकते हैं प्लेसमेंट अंडर टंग के, हम लोग जो है उसको टंग के नीचे रखने के कहते हैं, ताकि जो है वो अब्जॉर्प्शन हो सके और सिस्टमिक सर्कुलेशन में ड्रग जा सके. हमने जल्दी से जल्दी जो ड्रग ज़्यादा अनस्टेबल होता है तो हम चाहते हैं कि वो जल्दी से जल्दी अब्जॉर्ब हो जाए, उसका अब्जॉर्प्शन का रेट जो है वो बढ़ जाए, और ताकि हमें उसके इन्फेक्शंस के होने का और उससे जल्दी जो है वो ट्रीटमेंट का चांसेस मिल सकें. ठीक है, तो ये हमने पहला रूट जो है वो हमने कवर कर लिया. सेकंड रूट है पेरेंटल. तो पेरेंटल जो रूट इंट्रोड्यूस किया जाता है वो ड्रग में डायरेक्टली अक्रॉस द बॉडी बैरियर डिफेंसेस इनटू द सिस्टमिक सर्कुलेशन. तो यहाँ पर हम पूरे डाइजेस्टिव ट्रैक्ट से नहीं गुजर रहे, यहाँ हमने डायरेक्ट क्या किया, पेशेंट को इंजेक्शन लगाया, और इंजेक्शन के ज़रिए डायरेक्ट हमने ये जो मेडिसिन थी ये डायरेक्ट हमने पेशेंट के ब्लड के अंदर भेज दी, और ये मेडिसिन पेशेंट के ब्लड में आ गई. ठीक है, यहाँ पर ये हमारे पास ड्रग था, इस इंजेक्शन के अंदर हमने इंजेक्शन इंजेक्ट किया और ये ड्रग जो है वो पेशेंट के ब्लड में आ गया है. जबकि ओरली जब हम ये मेडिसिन ले रहे थे उसके अंदर हमने ये ड्रग रखी थी, वो जाता था पूरे डाइजेस्टिव ट्रैक से, वो गुजरता था, स्टमक में जा रहा था, वो स्मॉल इंटेस्टाइन में जा रहा था, और फिर जाके वो अब्जॉर्ब होता था और वो ब्लड में आता था. ठीक है, तो इतने बड़े रूट की बजाय यहाँ पर डायरेक्ट ये काम हो रहा है, तो इस डायरेक्ट पाथ को हम पेरेंटल पाथ कहते हैं. Parental administration is used for the drug that has poor absorption from the GIT. तो जिन ड्रग्स की पुअर एब्जॉर्प्शन होती है, जैसे हेपरिन है, इसकी बहुत ही पुअर एब्जॉर्प्शन होती है, तो इससे हमने इसको जल्दी से करना होता है तो हम इसको इंजेक्ट करवाते हैं. इसी तरह कुछ एजेंट्स होते हैं जो अनस्टेबल होते हैं, जैसे इंसुलिन है, ये अनस्टेबल होता है, तो जो अनस्टेबल हैं उनको हम इंजेक्शन के ज़रिए या ड्रिप्स के ज़रिए या किसी और एजेंट के ज़रिए से भी हम लोग दे सकते हैं. ठीक है, अच्छा, उसके बाद हम देखते हैं कि पेरेंटल एडमिनिस्ट्रेशन इज़ द ट्रीटमेंट फॉर अनकॉन्शियस पेशेंट. कोई अनकॉन्शियस पेशेंट है जो बिल्कुल बेहोश हुआ है, आप उस पेशेंट को कैसे एक ऑरली ड्रग देंगे, नहीं दे सकते ना, वो पेशेंट होश में ही नहीं है, वो स्वेलो कैसे करेगा. ठीक है, इससे जब पेशेंट की अनकॉन्शियस कंडीशन होती है तो हम उसको फिर पेरेंटल दे देते हैं, ताकि जो है वो ड्रग उसके बेहोशी के वक्त भी ड्रग उसके अंदर चली जाए. ठीक है, अंडर द सर्कमस्टांसेस दैट रिक्वायर्ड अ रैपिड ऑनसेट एक्शन. जब आपको रैपिड कुछ चाहिए, जैसे पेशेंट की डेथ का ख़तरा हो जाता है, तो हमें फ़ौरन इंजेक्ट करना पड़ता है ताकि हम पेशेंट की जान बचा सकें. डायरेक्ट उसके ब्लड में चली जाती है ड्रग और वो पेशेंट बच जाता है. ठीक है। दीज रूट्स हैव हाई बायो अवेलेबिलिटी, क्योंकि ये ज़ाहिर बात है ड्रग एक ज़रिया है, ठीक है, इतना लॉन्ग पाथ नहीं है, बिल्कुल शॉर्ट पाथ है, जल्दी से ड्रग ब्लड में चला जाएगा और जल्दी से उसका जो है वो यूज़ हमें मिल सकेगा। जो ड्रग ने एक प्रॉपर एक्शन परफॉर्म करना था उसके लिए एक हमें लंबा रूट नहीं करना। अच्छा, ये रूट हमारे इरिवर्सिबल है, बैकवर्ड नहीं जाएगा, ठीक है। कॉज पेन, फियर, इन्फेक्शंस जो है ये कॉज करता है, क्योंकि ज़ाहिर बात है कि जो चीज़ जल्दी मिल जाती है उसकी जो है कुछ ड्रॉबैक्स भी होते हैं, और जो चीज़ देर से मिलती है उसका मतलब आप कह सकते हैं कि मिठास ज़्यादा होती है। तो यही जो है वो फार्मूला इसके अंदर भी लगाया गया है। इसका भी रूट आप लोग देख सकते हो कि पूरा बनाया गया है कि आपने ये इंजेक्ट किया, डायरेक्ट वो ब्लड में आया, ये ब्लड गया पूरी बॉडी के अंदर सर्कुलेट किया, फिर आप ओरली अगर टेक करते हैं तो वो भी सब कुछ जितनी भी ड्रग्स आप लेते हैं वो लीवर के अंदर जाती हैं ताकि वो मेटाबोलाइज हो सके। सो ड्रग एडमिनिस्टर्ड ऑरली फर्स्ट एक्सपोजर टू द लीवर, तो जो अब ऑरली आप ले रहे हो वो जल्दी लीवर में जाएगा क्योंकि उसका कनेक्शन है जीआईटी से, और जीआईटी ट्रैक का डायरेक्ट आपका कनेक्शन जाता है लीवर के पास। बट जो ड्रग आप एडमिनिस्ट्रेशन करते हो इंजेक्शन के ज़रिए वो पूरे सिस्टमिक सर्कुलेशन में घूमता है, और जब वो घूमता है पूरी रेस्ट ऑफ बॉडी में फिर जाके वो लीवर से साथ मिलता है। तो इसे हम कहते हैं कि इसके कुछ ज़्यादा वो नहीं है, क्योंकि जो भी काम जल्दी में होता है वो आप लोगों सब लोगों को पता है। अच्छा, इसके अलावा यहाँ पर इंट्रावेनस इंजेक्शंस की बात की गई है कि किस तरह से हम इंजेक्शन देते हैं। इंट्रामस्कुलर कुछ इंजेक्शंस होते हैं और सबक्यूटेनियस की कुछ चीज़ें होती हैं जिनके ज़रिए से हम फ़ौरन जो है इन्हेलर्स और कुछ अदर चीज़ें भी दिखाई गई हैं। इन्हेलर्स, इंट्राजेस्टर